All right, welcome back. Well, we have some positive news to share this morning. The cancer survival rate is rising. So recent numbers from the American Cancer Society show that 7 in 10 cancer patients survive at least 5 years after being diagnosed. Now, this positive news comes as the Siteman Cancer Center right here in St. Louis launched its acute survivorship clinic late last year, and the clinic is meant to meet cancer survivors' needs most effectively as more people live longer after a cancer diagnosis. And we have a guest this morning to talk about all these positive numbers and the clinic, Dr. Lindsay Peterson, a Washington University medical oncologist with the Siteman Cancer Center. Thank you for joining us.
Of course, thanks for having me.
Of course. So first off, just tell us about the significance of this report that was just released. What were some of the key findings and what do you want people to take away from it? Because it is positive.
It's very positive, yeah. So what we saw in this report, like you mentioned, is that back in the 1970s, if you had a newly diagnosed cancer, you had about a 50% chance of surviving 5 years. Now you have a 70% chance of surviving 5 years, and that's for all cancers across the board. What's really interesting is that we're seeing a lot of increases in survival in some of the previously hardest to treat cancers. So cancers that historically had the lowest survival rates, that's where we're actually seeing some of the largest gains in terms of survival.
What were those cancers?
So liver cancer, lung cancer, melanoma, multiple myeloma, cancers that again historically had very low survival rates. We're seeing improvements in those survival rates, both in early stage disease and importantly in later stage disease.
You know, and I've done several stories with doctors over several years, and the biggest message they've said to me to explain to viewers is the C word isn't what it used to be. You know, it can be, unfortunately, for a lot of people.
Right.
But it's not what it used to be. Why is that? Is it because treatments are better? What do you think is the reason for this? Or is it a lot of different factors?
It is a lot of different factors, and treatment absolutely is one. So you look at treatments that we have today, immunotherapy, targeted therapies. These treatments didn't exist 20 years ago. And so we've really made huge strides in the types of treatments that we're able to give to people. But it's also better screening techniques. So we can find cancers at an earlier stage than we used to, and we know that finding cancers earlier leads to increased survival. So it's a lot of factors, including the treatments as well as our screening techniques.
And to kind of get to the basics for everyone at home, what is cancer survivorship? What does that mean?
Yeah, so cancer survivorship is really the care we need to give to someone who has or has in the past been diagnosed with cancer. So it's not their treatment and their scans, that's their cancer treatment. Survivorship is treating all the other parts. So financial concerns, social concerns, emotional concerns, the physical impairments that people are left with. Cancer survivorship is making sure that we're sort of taking care of the whole person.
It's not just like, okay, you survived, go on. You know, there's
Exactly.
more to it. There's a lot that happens after it. So what survivorship programs exist at the Siteman Cancer Center to help out with that?
Yeah, so really at Siteman, what we want to do is make sure that we offer survivorship services from the very beginning. So from the time you're diagnosed through your journey, we want to make sure that we have services available to you. And so in the beginning, we really want to focus on all of the services that are available to you. We want to make sure we're supporting you socially, emotionally, financially. And then as you go through your cancer journey, we want to make sure that we're addressing all of the physical impairments and other things that have resulted because of your cancer diagnosis.
What have you seen from patients to have something like this throughout this really difficult time in their life?
Patients, I think, are very grateful. They feel heard, they feel validated, they know that we understand that this is not easy. This is something that's very, very difficult to go through. A lot of patients come with their family members, and we have resources for caregivers as well. So I think people really appreciate that we're not just trying to make them live longer, but we're really trying to help them live better.
Yeah, and we know that February is National Cancer Prevention Month. What do you want people to think about during this time? How can people best protect themselves? I know that's an overarching question because there's several different cancers, but what do you want people to take away as we head into February?
It's a great question. I mean, I think the great thing is that there are actually things that we can do to help reduce our own risk of getting cancer. So lifestyle is very important. We all know about smoking. Smoking rates have declined significantly over the years. We also know that leading a healthy lifestyle with a good diet, being physically active, working towards a healthy body weight, all of these things reduce your risk of several cancers. And so that's what I want people to know, is that not only are we improving survival rates, but we can also really impact our own personal prognosis by making healthy choices.
It's sort of like whenever we tell flu stories and we're like, ways to not get the flu, wash your hands. You know, it's those
Exactly.
simple things, like you said, eating healthy, moving your body. It's those simple things that we sometimes don't think about.
Exactly.
That really can prevent it.
And
which
that's
is amazing.
Yeah, that's what people need to know, is it really does make a difference.
Mm-hmm. And y'all have a tool right now to discover risk for cancer and other diseases. Can
Yes.
you tell people how to find it, where it is, what it does?
Yeah, so if you go online to our website and you type in basic information. Everyone's going to know it off the top of your head. A couple different cancer types there that you can choose from, and it'll let you know what your risk is, how that compares to the average population, and then lead you to things that you can do to help reduce your risk.
Oh, that's so awesome. And when did y'all develop this? Has it been around for a minute?
It's been around for a very long time now.
Yeah.
A bunch of epidemiologists at WashU. We have a great group of epidemiologists, and they developed the tool years ago.
Wow, that's awesome.
Yeah.
And just a quick tool that you can use right now on your phone.
Exactly.
Yeah, that's perfect. Thank you so much.
You're so welcome.
We appreciate it.
Yeah, thanks
and
for
we
having
love
me.
spreading positive news, but also big takeaways. Eat healthy, move your body, don't smoke.
Exactly.
All right, it's as easy as that.